Today we are going to talk about osteomyelitis, which is the infection of the marrow of the bone. Myelitis means inflammation or infection of bone. Infection is produced by Staphylococcus aureus, which are gram-positive cocci, coagulase positive, alpha hemolytic on blood agar, and there are golden colonies, grape-like colonies on nutrient agar. So this is about the bacteriology of Staphylococcus aureus. They are originally found in the furuncle or infections of the skin and the hair, and they travel by the bloodstream through the nutrient artery, through the Walkman's canal into metaphyseal vessels. These metaphyseal vessels, as they near the growth plate, they have a hairpin bend, and as the circulation slows down in the hairpin bend, the bacteria are offloaded. So they are offloaded at these hairpin bends. Metaphysis is prone to osteomyelitis because it is near the joint, it is subject to trauma being near the joint, and because of the trauma there may be a hematoma, and lot of marrow cells form a good culture medium. So the bacteria are not only offloaded, they start growing there. Also in the metaphysis there are blood sinuses which do not have endothelium. Therefore the blood is directly exposed to the marrow cells where the bacteria can infect the marrow cells. So because of this good culture medium, they grow in the metaphysis, there is inflammation, and this inflammation can lead to abscess formation. Initially, before the abscess, there is edema in a closed space, because bone is a closed space. It causes increased pressure. Edema in a closed space causes increased pressure and thus ischemia. The blood cannot really go against this increased pressure, and therefore the bone becomes ischemic. Also, since the bacteria are coagulase positive, they cause clotting in the blood vessels and end arteritis, and therefore also there is ischemia. And therefore there is infective ischemic necrosis of bone, which is called as sequestrum. So there is a pus in the metaphysis. This pus leaks through the Walkman's canals, through the Haversian canal system into the subperiosteal space. It strips off the periosteum, leading to more blood supply loss and more ischemia. So the ischemic necrosis would increase. From the subperiosteal space there can be a soft tissue abscess, and this can breach the skin and lead to a sinus. The characteristics of the sinus are that there is sprouting granulation tissue, the sinus is fixed to bone, the bone is thickened and tender, and later on this chronic infection can cause amyloidosis or Marjolins ulcer, malignancy locally, and amyloidosis which can affect the kidney and cause renal failure. So you have to remember this sinus, because this is how you will get a case. This sinus is an osteomyelitic sinus because it is near the metaphysis. There is sprouting granulation tissue, it is fixed to bone, and the bone is thickened and tender. You will have to say these 3 or 4 things. Then we talk about the ischemic infected necrosis of bone, which is sequestrum. It has a granular surface because of contact with the granulation tissue, which is trying to separate it from normal bone. And it has got a smooth surface, which is because of subperiosteal abscess. If it comes in contact with the atmosphere, the H2S of the atmosphere combines with the FES of the hemoglobin, leading to black pigmentation of the sequestrum in the exposed area. In tuberculosis or in typhoid, the sequestrum are very small and they are called as rice grains sequestrum. Now, what surrounds the sequestrum is called as cavity. It is filled with granulation tissue and it is radiolucent on X-ray. Outside that is reactive bone formation, which is called as involucrum. So you have to wait for the involucrum to be sufficiently developed, sufficiently strong when you are trying to do a sequestectomy or removing the sequestrum. Otherwise, there can be a pathological fracture. Also, the cavity must be saucerized. It must be shaped like a saucer so that nothing collects in the cavity and the drainage becomes adequate. How do you manage osteomyelitis? First, you recognize it by a red hot, swollen, tender, painful metaphysis with decreased joint movements due to muscle spasm and with fever and toxemia. So near the metaphysis, there is red hot, swollen, tender, painful metaphysis. What else it can be? It can be a fracture, it can be an arthritis, or it can be a tumor like osteosarcoma or Ewing sarcoma. What else should you see? Lymph nodes. How do you investigate? There is polymorphonuclear leukocytosis. You must take an X-ray. And X-ray is useful in the chronic stage where you can see the sequestrum, cavity and involucrum, but not in the acute stage where you can only see the edematous tissue or soft tissue swelling. You must do an ASO titer and C-reactive proteins, and you must do a blood culture and sensitivity to recognize the Staphylococcus aureus and what it is sensitive to. Now, how do you treat? The treatment basically is an antibiotic. The clavulanic acid in the antibiotic increases the penetration of the antibiotic. Usually, Staphylococcus aureus may be penicillin resistant, but since this resistance is dose dependent, as you increase the dose of penicillin, the resistance is overcome. So you treat by a high dose penicillin. You must look for methicillin resistance Staphylococcus aureus, and then you must finally treat as per culture and sensitivity. Besides this antibiotic treatment, you must maintain the fluid electrolyte balance, the nutrition, and locally you must give traction and sumac strapping to decrease the edema and the swelling. You must monitor the general condition, the temperature, the leukocytosis and ASO titer. And if there is no response in 48 hours and the ASO titer is more than 4 times raised, this is an evidence of abscess clinically or radiologically. Then you drain this abscess, decompress the metaphysis by either decortication or by drilling holes. In chronic osteomyelitis, you wait for involucrum to mature to prevent pathological fracture. You do a sequestectomy and saucerization, and you ensure prolonged antibiotic use by antibiotic pregnated cement.